First, I think that business schools should not provide mental health courses because it will lead to depression among students due to a heavy workload. Students who experience distress will suffer academic impairment. They may feel stress and anxiety due to countless lessons, and they will also fail to do assignments given by their lecturers, and this may cause them to have a mental breakdown. Mental breakdown may ruin a student's future. So, instead of adding more courses, business school may improve their sport facilities to encourage their students to exercise more. Exercise can be an effective treatment by improving health and quality life of students, which they will help them to focus more in their study. If you say why, it is because exercise not only changes our body, it changes our mind, attitudes, and more.
Additional mental health costs may cause stress or depression to university students due to their heavy overwork. However, mental health costs will help students to face the reality, and it also helps to overcome any obstacles that they face during their university lives. For university can reduce the subject hour by 3 credit hour to 2 credit hour per day. By taking mental health course, students able to learn more about how they can reduce their stress and anxiety during in their university life. So, before they taking the additional mental health course, first students must know and identify what is their real problem and related it to this course. So, after they identifying their problem, by taking the course, student will have the information, and they should always keep in their mind that this course is not only for the one who have mental illness. It is also a useful and helpful course that they can be used in their future when they are needed it. Many people have complaining that taking this additional course will become a burden to university students, but we have to know that university students need mental health treatment and some counseling. So, due to the tight study time, university students are only able to attend some of the counseling section to address their problems. According to Els and Rando, they have mentioned, they say that students are typically afforded a limited number of individual counseling section over their academic career, which provided by the psychologists, mental health counseling, and lastly, social workers. So finally, university students should take the initiative to take this course in their subject, because this subject can be useful and helpful to them in their future, and it also can help them to avoid their grade at the lowest.
The second point, I think that business schools should not provide mental health courses is because students can take antidepressant to treat their mental illness. Antidepressant is a kind of medicines that help in reduction of the depression symptoms by altering chemical imbalance of neurotransmitter in our brain. Research of scientists revealed that the change in mood and behavior is due to the chemical imbalance. The medicine achieve their desired function by influencing the concentrations of neurotransmitter in the brain. The antidepressant inhibit reuptake of neurotransmitters through selective receptor, thereby increasing the concentration of specific neurotransmitters around the nerve in our brain. The antidepressants are used for treating depression safely without any side effects. The right medication to an individual depends on the clinical physiological conditions such as symptoms, possible side effects, and interaction with other medication, state of pregnancy or breastfeeding, and mental condition is also depends on the individual. Different classes of antidepressant are in practice depending on the type and requirement of depression.
However, mental health courses can teach students about physical and nutritional health. These courses can also teach students to interact and make connection with the others. Based on the survey, the rate of increase of student health problems and the academic competence is proportional as the falling level of physical fitness and rising rates of obesity has been observed and recorded among the school age students on all over the Malaysia. Good nutrition and healthy body are essential part of a person's overall health and well-being behaviors. So, in order to decrease the rate of depression and the take in antidepressants, students are encouraged to have more physical activities such as sports and joining the club activities. So, the course not only organize students to attend activities, but they plan to have students to have interactions and make friends with others. Students attending sports can decrease the rate of obesity as everyone knows that nowadays students are busy from studying and have more junk food and with the unhealthy lifestyle maintained. Students are encouraged to take more nutritious food like fruits to improve their health. Besides that, they also need to be informed that different age are required to take different nutrients based on their lifestyles. So they must know the quantity of the dish and help with a balanced diet to make a good food choices based on the nutrients, the content, and the quantity, which will help them to avoid weight gain. Thank you.
My name is Nolaila Khadra binti Omar. I will continue with opening argumentative 3. Introducing mental health course in business school will consume the free time of students. Besides studying in a university, students need to make time in order to spend with their family, friends, and attend extracurricular activities to give themselves some breathing room and prevent stress. Taking too many courses will make the students feel more depressed from time to time. According to Phil 2001, depressed students will lower their CGPA because they do not like to do the homework and assignment given by their lecturer. This negative impact of depression has on students' academic performance does not just hurt them and their families, but it has consequences for the economy and society as a whole because they are not receiving a proper education.
However, mental health course can provide students the basic awareness about mental health and also can reduce the stigma towards the patient that also suffer from mental illness. So according to AMEKI 2014, mental health courses such as metacognitive awareness teach about student characteristics, learning orientation, and self-regulation about the student. People who have developed metacognitive are able to assess their thought process and reframe the way they think to adapt the new situation. Using metacognition, students gain an understanding of the situation, process also the method that work best for them. So as the conclusion, we agree that business schools should introduce this mental health course because it provides many benefits to the student. This course can be helpful for the student to improve themselves, to improve their health, and also can be able to improve the school performance. But keep in mind that we do not want to put any pressure to the student, but instead we encourage students to take care of their body and feel pride in self-accomplishment to improve both physical and mental health, so that they do not face any problem in the future. In fact, the study of mental health can help the student to change their low interest in academic by teaching them about stress and also time management, so that they can be successful in their studies. It is good for their future too.